Hi everyone, welcome to the I Want to Be a Dentist webinar series. This webinar will be talking about the dentistry personal statement. Thank you for joining us tonight. We hope that this webinar will give you lots of insight into the dentistry personal statement, which is obviously a really valuable tool with the dentistry application process. We have got a really talented panel of lecturers on tonight who will be guiding you through each stage of the dentistry personal statement. In addition to that, we aim to wrap this up in about 60 minutes. If you have any questions at all with this particular presentation, please just message in the chat. We will do our best to answer your questions and get an answer to you. In addition to that, we will be recording this webinar, and the webinar will be published on YouTube within the next 48 hours. So if anyone has to leave early for any reason, don't worry, we will be recording this and we will be putting it on YouTube. In terms of today, I'm going to introduce the panel. So far today we have got a variety of dentistry students and dentists from around the UK. So Tavisha Handa is a second-year student at King's College London, an undergraduate. We've also got Alina Ayub, who is a fourth-year student at Leeds, Fadila, who is a fourth year as well at Leeds, and Dr. Basra, who is a foundation dentist. So that's when you finish your 5 years of undergraduate training, you become a foundation dentist, and myself as a former interviewer and dentist. So I think we'll slowly make progress because it's been a couple of minutes now, and we will begin with the first presentation. So just before we get started, actually, I just wanted to mention who we are. So we are just an organisation that helps students with getting into dental school. Obviously, we have various services which help you throughout your the entire stage of your application cycle, from the very beginning all the way through to the end. So we like to offer our support and help. We have a bursary scheme which we are really proud to provide to students who come from less fortunate backgrounds. So if anyone has any questions regarding that, just message us. We also have a book which has just recently launched. It's like a comprehensive guide to dental school entry, which contains lots of really valuable resources, and lots of very talented people have been involved in that. Lots of dentistry students with lots of valuable experience. So that is available on Amazon as well as an ebook and a paperback copy. So I'm going to introduce Alina, who's going to be talking about why the statement is key. So Alina, would you like to begin?
Hi, yeah, so I'm Alina, I'm a fourth year dental student at Leeds. So I'm going to be talking about, firstly, why the personal statement is key. Obviously, you guys know how important it is as an aspect of applying to dental school. There are many factors that are involved in applying to dental school, and this is kind of like the first stage after the UCAT or the BMAT. And this is where you really get to showcase yourself. So it's your opportunity to really show them what you have to offer, your qualifications, your interests, your hobbies, how you've explored the dental world, the whole thing. And this is your chance to kind of put it in one document and really showcase yourself. And the great thing about this is that you have total control. So you get to show what you have to offer, and you put it in your own words, and you get to present yourself in kind of the best light possible. And it's really, really key that you do this. And when you showcase yourself, you make yourself stand out, and it makes you it puts you aside from other people who have applied. And this is what helps reduce the application pool. So universities, if they read your personal statement and it really stands out, or it's really impressive, when they start reducing the pool of people applying, you will be one of those people that are in the reduced pool, those people that they really want. So that's really important. And then another reason why the personal statement is key is that it's used in your interviews. So a lot of people think that, right, once I've done my personal statement, that's fine, now I'm into the next stage. But you have to remember that you bring that along with you to the interview. So sometimes there's a station specifically about talking about your personal statement, or sometimes there's just some questions on it in different stations or in a panel interview. And so you need to be able to have a personal statement that you can talk about, that's got content, that's got substance, and it has to include things that you're passionate about and things that you know very well, because you're going to have to explain it and present yourself. So for example, if you start talking about an experience that you had in a dental practice, they could ask you about that. So it's really important that you kind of know what you're putting in your statement, it's got substance and it's interesting. And then another thing is that when you hand in your personal statement, it's used as a shortlist for interviews. So they take in your UCAT or your BMAT, and they also take in your interview. And that's how they kind of create the pool for applicants that they want for the interview. So they're going to be looking at whether you're motivated, have you explored different paths in dentistry or the dental world in general? Is it truly something that interests you? And then, are you suitable? So have you shown that you've got the skills for a dentist? Have you shown that you've got that kind of motivation? So yeah, that's kind of why the statement is very key.
Thank you. Right. So we're going to go on to the next part of the presentation, which is on how you can prepare to make your statement stand out, and that will be Dr. Batra.
Hi guys. So yeah, I'm just going to go quickly into how to make your statement stand out. So firstly, make sure you have something to write about. So it's all about preparation, and you'll learn throughout all of dentistry and beyond, preparation is key. And you may think like, oh, we're writing our personal statements now, but it's never too late. So in a personal statement, they're looking for work experience, roles of responsibility, manual dexterity, leadership, teamwork, to name a few things. But as mentioned before, it's things that will make you suitable for being a dentist, and that's what they're looking for. So if you're thinking right now, like, I haven't got some of those things, it's never too late to start. So what I'd say is make a list of things that you've currently got that you want to talk about on your personal statement. And if it's looking a bit scarce, you can always start something. So for example, manual dexterity, you can always start like knitting now or piano, and you can write that in your personal statement as long as you're committed to doing that until the interview phase, because whatever you write in your personal statement, as mentioned before, will come up in your interview. So you need to make sure that anything you're putting in there is something you're going to be committed to. Same goes with work experience. Sometimes people can't get their work experience done before the personal statement has been submitted, but you can still write down that you've got it planned, so they can see that you are prepared and that you are still passionate and wanting to show that you're interested. So for example, in my personal statement, I was going to America to do a charity event which was to do with dentistry. And that hadn't happened yet, but I wrote it in my personal statement. It was something interesting and it was something I was committed to. So I still did it before my interview stage. And therefore it was a really good talking point at the interview. So it's never too late. Secondly, look at successful examples. I can't stress this enough. We have it in our book as well. We have examples, but every dental school have a set criteria or personality types that suit dentistry. And you will often find a trend within personal statements that get through to the interview stage because they're showing specific personalities, specific traits that a dentist would have. And so looking at these examples, you'll pick up what kind of similarities there are, and also structure. And you'll gain information of like things that you like. So you'll see it in someone else's personal statement and be like, I really liked how they put that, and I'll adapt that to make it suit me and show my personality. Then make a points list. So write out a list of everything that you've done that you think is interesting, that you think will make you stand out, that makes you a good dentist or will make you form into a good dentist. And then show that list to someone else and say, what in that list really catches your eye that you'll think, wow, that's something I've never heard of. Because then that way you can rank it most interesting to least. And then you have to remember you've got a word count. So the most interesting you can have more, you can allow more words for, and less interesting you can either cut or just mention briefly, which leads me on to my next point of generic points. if it doesn't seem interesting, just take it out. You have to remember your personal statement is showing your personality. And if you are just a generic personal statement, that will just go to the side and it's not memorable. You need to, if you're reading your personal statement and you're looking at going, that's not me, like I don't relate to it at all, don't submit it. Okay, you need to be able to show, you need to be proud of your personal statement and be like, yeah, that shows who I am as a person, because that's the only way you're going to stand out, and that's the only way you're going to be able to speak passionately about it at your interview phase. Like I mentioned before, preparation is key. So start early. Don't rush with your personal statement. I can assure you it's taken all of us many, many rewrites over and over again. So don't feel like you have to get it right the first time. And with that comes peer review. So every time you make a new edit, show someone, show one of us. We obviously have our services available. Show your peers, your teachers, anyone that will give it a read, because they can often spot things that you don't notice and make it more, like make it flow more. And they can also highlight, like I said, the points that make you stand out, the points that you're like, wow, I've never seen that before. And that will help you highlight it in your personal statement. So yeah, I hope that helped a little bit.
Thank you, Jazz. That's great. I've just for everyone's benefit, I have actually placed the links to the free statements, that are example statements, in the chat for people to browse as well. So we're now going on to how, once you've obviously sort of got the need to develop a personal statement, how are you going to structure it? So that's what Fadila is going to be talking about now.
Hi everyone, I'm Fadila and I'm a fourth year dental student at Leeds. I'm just going to go over the ideal structure to follow for your personal statement. So starting with the introduction, you want your introduction to be really powerful, unique, and to stand out, because it's the first thing that the people sifting through your application is going to see of you. So kind of sound like a year 9 teacher here, but you need to like grab your reader's attention and kind of draw them in. So after all, the university is going to use this statement, this piece of writing that you've submitted to them, to decide whether or not to offer you an interview. So you really need to make it stand out. In terms of what you're focusing on, you should focus on like your initial interest in dentistry, so how it kind of sparked, as well as like your motivations behind pursuing the career. And then section 2, we move on to your past experiences. So this is really about illustrating your work experience, firstly in the dental setting, because for most universities, you need a minimum of 2 weeks shadowing. Obviously with COVID and things, that's a little bit different, but you basically need to show that you've looked into dentistry specifically as a career and had some shadowing or some experience. Then you can also cover any other sort of volunteering here as well. But the most important thing is reflection is of utmost importance. So it's not about what you did or how many weeks or how much time you spent. It's more about your ability to demonstrate sort of what you learned and what you took from it. And that's kind of where what the interviewer is looking for. In terms of the third section, we're moving to extracurriculars. So here you really want to show the reader you're not just like a boring square interested in science, dentistry, and your predicted 3 A's. You want to show them you're like an all-rounded person with a multitude of skills that can link back to dentistry in some way, shape, or form. Like it says on the slide there, you know, some examples include EPQ, sports, arts, any roles you maybe took up in an extracurricular committee, and definitely include an example about your manual dexterity, because that's something they typically look out for in these personal statements. So this could be something like sewing, knitting, playing an instrument, anything involving your hands really. And then finally, your conclusion. So you don't need to worry too much about this part. It's really just a couple of sentences to bring everything together that you've talked about and then your statement nicely. Cal, I think you're muted.
Sorry. Thank you, Fadila, for that. We're now going to be talking about the guidance on getting started. Alina will be talking about that now.
Yeah, so now we have to kind of think about how we want to kind of put everything together. So we've done the UCAT, we've kind of focused on that, and now that's out of the picture. We now need to focus on how we get started on the personal statement. So writing isn't natural to everyone, and that's absolutely fine. So there's a lot of steps that you can kind of follow when starting to make the writing a lot easier. So kind of start by thinking about why you want to do dentistry in the first place. Why is this a passion of yours? What's interesting about the career? What's inspired you? All of these ideas, and try and gather those into one place. And I found as well personally, brainstorms or kind of jotting down ideas was really, really helpful. So talk about your past experiences. So have you had any experience in a dental clinic? Have you been to any dental fairs at all? Anything like that? Have you got any super or extracurricular activities? Anything that's kind of allowed you to pick up different skills? And so these are kind of all the different things that you can start jotting down. So no one expects you to kind of write the whole thing in one go. That's absolutely fine. No one does that, and it's not expected. So it's really, really important to kind of jot little things down. And then later on, you can kind of compile that into one full personal statement. And one thing, Fadila mentioned it as well, is that it's really, really key to talk about what you've learned from different experiences. So you can say that you've had 10 million plus hours in a dental clinic, or you can say that you've done this and you've done that, but they're not looking for that. They're looking for what you've learned. So for example, there's this one here that's written below. So if you're part of a football team, you've learned about teamwork skills, and then how do you relate that to the dental world? Or for example, if you've had experience in a dental practice, maybe you've noticed how communication is really, really key, and then link that to the dental world again. How is communication key in the dental world and working as a team? So they're really, really looking at the reflective side of things overall. And then once you've kind of had those thoughts, you've thought about how you've reflected, you thought about the skills that you've had, the experiences that you've had, how are you going to put that into a personal statement? And like I said, no one expects you to write it all in one go. You are going to have lots of drafts, and we've all been there. We've all had so many drafts. We've had different things in note form. We've had it in one go. There's been so many different ways in how you can write a personal statement. So no one's expecting you to write it basically all in one go. So do your first draft. And once you've done your first draft, maybe get someone to read over it. So whether that's a parent, a friend, a teacher, or even maybe a dentist that you know, get them to read over it. And a key thing here as well is the fact that it's really, really important to maybe leave it for a few days and come back to it. So we've all revised for exams before, and we've got our mind boggled by reading the same textbook again and again, days on end. When we wait a few days and give ourselves that break, we have a fresh mindset, a fresh pair of eyes, and sometimes you can tackle it in a better way when you give yourself a break. So just don't drive yourself crazy trying to write it all in one go, and do as many drafts as you want until you're ready. And one thing that comes into this is just give it time. So don't try and write your personal statement all before the deadline. Try and give yourself time to write the statement. And then, of course, because you're passionate about dentistry and passionate about wanting to get in, you may go over the word count, and that's just where rewording becomes important. So how are you going to shorten the words? How are you going to reword it in the best way? So yeah, that's just on how to get started.
Thank you, Alina. That's great. Okay, so we're going to now go on to quite an important part of the statement, which is to do with what to include and what to avoid writing your dentistry personal statement. Obviously, it's a limited character count, so you're conscious of how much to put in. So you want to be making sure that everything that you do put in to that statement is relevant and necessary for you to stand out, and you to obviously stand out in the eyes of the person reviewing that statement. So Fadila is going to be talking about this important aspect.
So in terms of inclusions, we've kind of covered it so far, but just to kind of reiterate, you need to cover your motivations behind wanting to do dentistry, definitely your work experience, or in light of what's going on at the moment, just some sort of steps that you've taken to gain insight into dentistry as a career. And then you're looking at any achievements, extracurriculars, hobbies. Again, make sure you have something that's relating to manual dexterity. And also within that, you need to include how you understand the role of a dentist. So this comes in the form of linking back all the skills and qualities that you may have developed through work experience, through volunteering, any extracurriculars, and linking them back to your understanding what the role of a dentist entails. So there's always quite a few buzzwords that you kind of need to hit, but that'll be covered later in the PowerPoint. And then thinking about work experience specifically, I know this is something that a lot of you may be worried about in light of COVID-19, just because it's quite hard to get work experience at the moment. So there's a quote here that's taken from Birmingham. Don't know whether to actually read it out or just let you read it, but basically the essence of it is that you won't be at a disadvantage if you haven't managed to secure some work experience for yourself, because they are aware everyone's in the same boat, you know what I mean? So you need to not like worry too much about the fact that you haven't gain work experience, but just make sure that you've taken some steps to gain understanding. So this could be in the form of online courses. I know I Want to Be a Dentist. We have an online course, a work experience one, and that kind of talks you through the skills and qualities that a dentist requires. And basically through that, you'll gain a certificate. And using that, you can kind of mention in your, whether that's your personal statement or even at interview stage, that you have an idea because you've being proactive and taking the steps to utilize this course. So for work experience in this second kind of bubble here is talking about how you should think outside the box. So if you're not able to secure work experience in an actual dental setting, you can maybe reach out to dentists. There's a couple of dentists on this panel, even a dental student, because we kind of have an idea of the role of a dentist. So like, feel free to message any of us on Instagram or anything. So even speaking to us, getting an idea, you can kind of say in your personal statement that you were proactive and went out of your way to message those in the dental field to get an idea of the profession. So that's already showing that, you've taken those steps. There's also getting in touch and asking if you can rearrange your work experience for later in the year. So again, you've been proactive, reading around the subject, and then also, like I said, the online courses. So here they're really wanting to see that you've gone out of your way, made the effort, and because of that you have some understanding of what being a dentist will entail, and so you know what you're getting yourself into. You're not just going for something that you know as a concept. In terms of what not to include, I'm hoping this will be quite sort of self-explanatory, and I'm sure you guys all know this anyway, but obviously don't use terminology you don't understand, don't be dishonest. And pretty much the reasoning behind all of this is, well, in terms of being dishonest, you're going into something where you're going to be a healthcare professional. So you're going to be in a position of kind of responsibility, a position where people are going to trust you. So you early on, you need to kind of emulate these qualities within yourself. But also at interview stage, if you are to be invited for an interview, your personal statement is something they sort of pick apart and use to ask you questions. So if then you've used the kind of terminology that you don't actually understand, just to, sound like you know what you're talking about, they could then ask you about it, and it can become quite evident that, you don't actually know what you're talking about. And this will definitely, reflect quite badly on you. So you want to definitely avoid this at all costs. You definitely don't want to, I've said definitely way too many times, but you don't want to be appearing very financially driven. Think about the empathetic aspects of dentistry. So all those kind of ideas about wanting to help people, giving them confidence by changing their smiles, those sorts of things are the kind of motivations that you want to talk about. You don't want to be belittling any other career options. Show that you're respectful. As a dentist, you will definitely be working in a team, so you need to show appreciation of your dental nurse, your technician, and you don't want to be putting any of these other careers down. No lists without explanation or examples. Again, this kind of goes back to what me and Alina were saying about your work experience. So you don't just need to kind of tick boxes and get those kind of words and get that terminology in there. You need to sort of hone in on a couple of examples and explain them, because that shows a lot more than just a list. And then it goes without saying, don't plagiarize. You just don't want to be doing that. But yeah, I hope that was helpful.
Thank you, Fadila. So we're going to go on to the next slide, which is to do with graduates. So I think if you're a dental graduate, if you're a postgraduate applying to dentistry as your second degree, then there's certain things that you want to be including. So it's really important to be able to use the skills and the projects which you've actually done during that undergraduate degree and relates to how they may be useful as building blocks towards studying dentistry. I think it's important to discuss any modules that you may have done that may be very specific. So these, for instance, could be if you've done an anatomy module that you've learned about the mouth or the salivary ducts or the glands in the mouth, or things that could be related that may not necessarily be directly to do with teeth, but something that is related to the head and neck area is key. In addition to that, you must discuss your motivation with undergraduate applications and postgraduate applications. It's really important to know your why. I think your why is one of the biggest things in your personal statement, which the assessor will be looking at. So it's really important to have the right reason to be going ahead with a career in dentistry. In terms of research is really, really important as well as a sort of person going in postgraduately. Having any aspect of research or project involvement where you're working within a team is really, really valuable to talk about. Interpersonal skills, of course, as a dentist, you'll be talking, you'll be working in a team, you're going to be hands-on. So it's important to be able to communicate any time in which you've been involved with that type of environment in a team, communicating. Other things which are strongly viewed upon are volunteering and of course being genuine in your application, and that comes back to your reason why you want to pursue dentistry. Again, things that you want to exclude are very, very similar. Complex terminology that you may not be aware of, I think, is very important to avoid. However, I do think it's important to know the basics. For instance, if you see a silver filling being placed, or you're aware of a silver filling, rather than calling it silver filling, call it an amalgam filling, because that's the correct name for that. In addition to that, it's important not to be dishonest. So anything that you do say, you must be able to evidence that. Even if you're going to do it in the future, you must sort of not lie about anything. Of course, as Fadila's explained, your colleagues, other careers, it's important to not talk down upon them. And of course, copying, we don't want to be jeopardizing your dental career before you've even begun it. Okay, so I'm going to pass it on to Davisha now, who's going to be talking about how you're going to actually assess your own statement, which I think is a very important aspect. Okay.
Hi guys, I'm Davisha. I'm a second year student at King's College London. So as Cal mentioned, I'm going to be talking about how to assess your own statement. So when I did it, and I think when anyone did it, this is, I think, probably the most tedious part of the statement, because you have to go through so many drafts. You're constantly checking what you're writing, constantly changing what you're writing until you get to your final draft. Now, there are 5 things that, as you can see on the slides, that we want to work with. So first thing is it actually fulfilling the purpose? Is it telling the universities that you want to apply to study dentistry and that you're going to be a good student at their university? Are you going to benefit them? Then we're going to be checking how to check your content. We're going to be covering what the right buzzwords are, what the universities look for, what kind of things they're looking for in a candidate. And then we're going to focus on cutting it down, making sure it fits the character limit, and then final checks just to make sure that your statement is really impressive. So on to the next slide, please. So does it fulfill the purpose? Sorry. So is it showing that you have the qualities or the skills that you can develop on to become a good dentist? So this is, can you listen? Do you have compassion? Do you have empathy? Are you organized? Are you able to manage stressful situations? These are all things that the universities are going to assess at interview, but also just seeing before in your personal statement if you can prove that you've dealt with these sort of situations. So people often show examples of DOV, where they've shown leadership and teamwork skills, or volunteering, so working in a care home, for example. They show they have compassion and empathy, and if they've talked to elderly residents, they can prove this. Are you showing that you have any motivation to study dentistry? Have you done work experience? Have you done online courses? Obviously, in this climate, it's a little bit different how you show this, because before it would be work experience. Have you read articles? Have you explored what it's like to be a dentist, be it through in-person or online forms? Are you someone who actually wants to help people? As mentioned before, not just for your monetary purposes or anything else other than that. You want to show you're there for the right reasons. Are you interested in science? You need to know that you're going into a course that's 5 years long and intense. It's not an easy course. Do you have the skills to be able to cope with the course? Do you understand that there can be some withdrawals to the career? There are challenges to the career. Nothing's perfect. And are you aware of this? On to the next slide. So checking the content. There's obviously so much to cover in a personal statement. And there's obviously so much to say. So you want to make sure that what you're putting in there really is the best form of selling yourself. It's the most important thing you want to put down, and it shows to the university the qualities that you want to show them. So you want to, but at the same time, you want to make sure you're not repeating yourself. So if you've done 3 things that showed the same thing, just use the most impressive one and explain it. So for example, if you've been on a sports team, D&V, and you've organized a group project, all 3 things can show teamwork or mentoring or leadership skills. You can just use one and really develop that example and demonstrate the skill you want to show. So leadership, for example, in a sports team, you can say you helped to organize and you led a team, and this led to a successful outcome. So by developing that one example really well, you can show a number of skills. And make sure everything you're talking about is relevant and specific. So you want to make sure that everything relates back to dentistry or the skills that you need as a dentist, or the skills that you're trying to show the university, because otherwise you're just wasting space and characters that you need. And then on to the next point, please. So here's just a really big list of buzzwords, really. I urge you to maybe stop for a minute and take a picture or note some of them down. I think the PowerPoint will be sent to you later, but obviously don't try and tick off every single word because it's obvious then, but make sure that you've incorporated quite a few of these words, because this is, like I've mentioned, what the universities are looking for. They're looking for these skills. They're looking for, do you have what it takes to develop these skills and become a healthcare professional in the future? So try and incorporate as many of these as you can naturally. Don't force them. Sometimes if you're struggling for things to write in your personal statement, you can come back to this slide and think of what you've done. On to the next slide, please. So cutting it down. As I mentioned, there's obviously so much to say. So good ways of cutting things down can be avoiding repetition, avoiding saying the same thing many times. Don't overly explain things. Remember, the people reading this are qualified and are dentists, so you don't have to explain a procedure, for example. They'll know what the procedure is, or you don't have to define things, as they'll know what that is. You can avoid, if you really are struggling, place names, generic phrases. Like I said before, anything that's not linked to dentistry. You can cut down using shorter qualifiers, or just getting rid of qualifiers such as really, extremely. Elaborate language that doesn't need to be used, filler words, and unnecessary verbs. So by using this, you can really cut down and actually make sure you have the characters in your personal statement to show the important things and showcase your skills and your qualities that you are selling, really, and that the university are looking for in your personal statement. That will help you stand out. And on to the final part of the tips on how to assess your statement, the final check. So making sure your spelling, your grammar, your punctuation, that's all correct. You can get a friend to check it for you. By doing this, you're making sure that your personal statement isn't instantly written off as someone who can't even be bothered to check their simple grammar and punctuation. So that's all I'm going to say about assessing your statement. I'd say that make other people read it, show it to your friends, show it to your parents, show it to your family, because they can guide you on, give you tips and advice on what to cut down, what they may think is irrelevant, and spelling and grammar things. You can also show it to any of us here at I Want to Be a Dentist, and we can help you out with your statement, and good luck.
Thank you very much for that, Tavisha. Lots of information there. We're now going to move on to actually very important topic, which is medicine versus dentistry. I think a lot of people at this stage get quite sort of confused as to how do you make your statement stand out so that it doesn't sound as though it could also be a medical application. So Jas, would you like to share some light on this?
Yeah, so as you said, a lot of people and ah between medicine and dentistry, but as a dental school, if they get a sniff of you using the same statement for both medicine and dentistry, you're automatically ringing alarm bells for them, because then they're thinking, are you actually in it for dentistry or actually in it for the medicine? Like, where is your mind? Because we are two different, completely different things. And also it can be a question asked at interviews. So we'll go through the 5 points here. And yeah, if you have any questions at the end, then please put it in the chat. So firstly, combination of role of physician and surgeon into one. So as a dentist, we treatment plan people, and they often come to us in pain or with issues, and then we treat those issues. So we go ahead and provide what we set out and what we had planned to do. Now in medicine, I'm not saying all medicine, but in some parts of medicine, that's not the case. You would often refer or be seen elsewhere, or you just deal with the immediate issue and then send off to have later discussions with other doctors. So for us, we do see a patient from start to finish. And onto my second point, continuity of treatment, we often see the same patients for many years. So you get to know your patients, you get to know them, they put their trust in you, and you are their dentist for life. You're not like going around between different people. So that's another huge thing that's different between medicine and dentistry. You could be in medicine, you could be seeing so many different people's in and out. If you're in hospital, if you're a GP, then it's different. But again, it's just depending on what kind of path you go down. Psychological impact, that's pretty straightforward. As a dentist, the worst thing you could probably do is make them lose a tooth. In medicine, obviously their life is at risk a lot of the time. And so you have to deal with a lot more emotional support when you're in medicine. So like with death and with having bad, hard conversations. With us, the hardest conversation is probably that you have to lose a tooth. In day-to-day dentistry, obviously there are other things that we as dentists can pick up, such as oral cancer and things like that. But it's less common for us. And again, that's when we refer out of our scope. So we go off and refer to an oral surgeon or oral medicine. So it's very different. There's a wider impact to dentistry. Everyone needs a dentist. Everyone needs to see a dentist. And dentistry doesn't start at the age of 50 when you're old. It starts with kids 0 years old, and the teaching side of dentistry is as important as the actual application of dentistry. So making sure that you can have impact in other ways. So like you can go to schools and teach children about dentistry. You can go to care homes and help there. There's so many things within dentistry that you may not think about, but when you actually sit the course, you realize that we're a much broader topic than just your mouth. And there's so many other ways you can apply what you've learned from dentistry to other areas of life in general. And secondly, lastly, work-life balance. So you can make dentistry what you want. So you can do just the 9 till 5 if you want. You can do the 3 days a week if you want. At the same time, you could work in hospital. You could do something, go into, looking at instances like maxillofacial surgery, oral surgery. There's so many pathways that, again, when you're at school, you don't realize it's not just teeth. You can change to different sides of things when you go into dentistry. And medicine is the same in that respect. There's different parts of the body, obviously, and you can work in hospital. You can work just as a GP. You can work as a surgeon. So you have to look at it in the sense that medicine is so diverse and so psychologically quite hard, and also you have to go into hospital. You have to do that to be a medicine. You have to see all those things. Dentistry is your choice if you want to go down the hospital route. It's your choice if you want to stay in practice. So I feel like they are very, very different. And people that are considering both really need to speak to dentists and speak to doctors and understand how their lives different, and ask the questions like, do you think your life will fit into that lifestyle of a doctor or a dentist? Because it's not just down the medical pathway, like, oh, dentist, doctor, you know, both in the medical field, they are, but they're very, very different, and they're different parts for a reason. So definitely talk to more people and go do your work experience at a GP, go do your work experience at a dentist, because I did that. I did both, and immediately going to a dentist, I felt way more at home than when I was at a doctor's. So it's about experience before you make the decision, and make sure you made that decision before you start writing a personal statement, because doing it halfway through, you know, you've already lost that. You need to know what you want to do before you start tackling it. And yeah, that's basically it. Have you guys, any of the other speakers, got anything to add to that?
No, I agree with everything you've said there. It is a difficult decision at such a young age to make, but you would only be able to help yourself with answering that question by speaking to people who are doing what you think you want to do. So yes, it is very much a decision on whether this career, because it is a career, once you start dental school, you are effectively training to become a dentist. And of course, it's whether that it was going to be something that you're comfortable with and something that you can enjoy ultimately, because it is something you'll be doing for you know, reasonably long time. I think in terms of the difference between dentistry and medicine, dentistry does have a very it's very fortunate in the sense that if you do work in a high street primary care practice, then you have a choice as how many days in the week that you want to work, because most people are self-employed. So it's quite a nice career to go down with regards to that. Anyone else have any points to add to that from our team? No. Okay, so we'll move on to the next slide, which is a statement example. So unfortunately, Raza is unable to attend the webinar tonight. However, this is just an example of a personal statement that was actually sent in and rejected. So this is basically an example of the things that we can look at together and explain why this particular statement got rejected. So the first thing you can see is that dentists can save lives. I think that that's quite it's a very bold statement, and generally when you're addressing the first paragraph in your statement, you really want to be starting with, you know, your why. And I think in this case, it was a very bold statement, and in a way it can be seen as sort of the wrong thing to say initially. So this, if we read on, I was told this when I was a professor at the end of the summer residential at the University of Birmingham, with naive question being why dentists paid so much. So obviously this individual has gone about it in a way where he's implying some sort of financial gain from the career. So again, mentioning things to do with payments and finance is not something that we advise. Usually when people go to the dentist, they are most concerned about whether they have cavities or not. However, the dentist is not only looking for signs of decay, they're also looking for signs of oral cancer, which can be as simple as a sore feeling at the back of the throat. And that's a good point that the individual has raised with regards to the awareness that when the dentist goes to practice, oral cancer is something that can be detected during a routine examination. This fascinated me, as I understood how dentistry can enhance the longevity of life, not just the quality. He's then gone on to, or this person has then gone on to obviously conclude that. But I think in terms of the way that the statement has started, it's not ideal. We can then go on to my interest grew further for the career as I began volunteering every Saturday at an elderly care home. This is where I assisted with hygiene and helps elderly disabled people around their day. It's a very valid point that the individual has raised. We'll read on. I feel grateful for having spent time with patients with dementia, Alzheimer's and strokes, to name a few. Experience has made me appreciate life whilst focusing on patient care through engaging in conversation and being there for patients whenever they need assistance, replicating for me the roles of a dentist. I think that the way that this individual has obviously related how their experience could relate to a dentist is valid. I think that if you have done some volunteer experience, then it's very important to detail the types of people that you work with. So this individual has named the dementia, the strokes, and I think that it is, important to also link maybe how that particular condition has impacted their oral hygiene, their habits, their ability, their manual dexterity to clean their teeth. I think that would be something that I would suggest in this statement that could be changed. I continued my work experience in a practice where I shadowed a dentist for 3 weeks. Each day I observed the fluent communication between the dentist and the nurses whilst providing personal care for each patient and delivering a quality experience. Manual dexterity was another skill often illustrated by the dentist while conducting surgical extraction in a small workspace. Through playing the ukulele, I've improved motor skills as the instrument is small in size, requires focus and stability, as well as conducting titrations in chemistry, which require fine measuring ability. So in this particular example, the individuals obviously talked about the fact that they've done experience, which is great. I think if you're fortunate enough to get experience, then that's fantastic. But there's loads of other things that you can do to develop your career insight. That's what they'll be wanting to see, not work experience, it's career insight and being able to gain information and understanding of what the career involves. So I think this individual has mentioned a few valid points with regards to communication, personal care, manual dexterity. These are all very valid points. And I think the more things that you can raise with regards to the qualities and the observations and the skills that a dentist would possess and relate them back to what you can do, that's even better. Working in a ceramic dental lab gave me the opportunity to produce a crown and a bridge, giving me invaluable insight into the efficiency of a multidisciplinary team, communicating through different departments. I witnessed how technicians, dental hygienists, and dentists all act together through the team in the dental practice being below the lab. So again, very, very valid point. This individual has done some wider work experience, and that is great, but you don't have to limit it to dentistry. You could do work experience in other fields and still relate that back to how that reinforces your career going down dentistry. But of course, if you have done something which you've been able to manufacture something like a crown or a bridge, and that is very valid to put in. In 2018, I visited Pakistan for 2 weeks to provide aid for those affected by the disaster of the earthquake. Working with the community appealed to me as I made a difference to people's lives, which gave me a sense of gratification that one day I wished to achieve as a dentist. So I think, of course, going and doing volunteering work is very, very good. It shows that you are selfless as well, and that is a very valid thing to do. And with the COVID situation, there's a great opportunity to do voluntary work. During my gap year, I've taken active steps by arranging hospital appointments, as well as working with spectators on my weekends, and greeting patients and doing pre-tests, answering phone calls, communicating with optometrists. I'm able to improve my independent skills while gaining experience in a healthcare environment. I wish to evaluate my previous weaknesses and improve as an individual in this year. I hope that this shows my devotion towards the cause. So obviously this individual has obviously taken a gap year and has been proactive. So I think that's the key thing. I think if you do have a setback, it's important to be proactive and engage in something that you can do. And this individual's obviously has been working in this this Specsavers, which is obviously a healthcare environment. And I think that's a very good thing that they have done. I'm just going to move this out of the way. So in terms of the next bit, having read the Smile Stealers showcased to me the development of dentistry in the different stages. One of the most interesting things for me was, so this person's basically read this book, which is apparently a very, very good book. So if you haven't read it, then I'd certainly advise. It's a good one to read because it talks about the different changes in history that dentistry has gone through. And of course, then they've concluded with, they've signed up to the Oral Health magazine. So I think that this, you can see there's various weaknesses in the statement and various areas where it can be improved. I think the conclusion is quite blunt and could be tailored better to almost conclude this more succinctly as to why this individual then wants to pursue dentistry as a career. Okay, and then we're going on to the next one, which is an offer. So let's have a look at this one. So when hearing dentistry, people immediately think decay and subsequent fillings. However, dentists are concerned with so much more, from monitoring signs of oral cancer to assessing whether the aesthetics of a person's teeth is affecting their confidence. So immediately, it's a engaging statement. This person has obviously shown that dentists are not only concerned with cosmetics, but also other aspects. They've also gone on to describe a specific type of oral cancer, which may, and then also the signs of that in the mouth. So this is someone who's obviously done some research into oral cancer because of their own fascination, and obviously linked it into the life-changing impact that it can have. Then we're going on to the volunteering, so the care home, and talking about the assisting the disabled residents and talking about their hygiene. So here we can see that the person has described the residents in quite a lot of detail. So speaking and engaging with the residents, I enjoy their company, the stories, and gain an understanding of how their medical conditions affect their life. So this person's obviously explained, explaining that the experience has not only taught him about the hygiene of the patient's oral health, but also how their conditions have affected them, and related it to holistic care, which is very important. In addition to that, they've gone on to speak about they have made a difference in their community with helping in the healthcare environment, and then obviously going on to do work experience at dental practice. They then go to sort of specifics of what they observed with regards to the standard of care, the anxiety control, the technical skills, and in addition to that, the dexterity. So these are all key valid points that this person has mentioned in a very succinct manner and quite cohesively as well. So it's flowing very well. So they've mentioned a point, they've then gone on to the specifics of that particular observation and then related it to specific things that they've seen, and then reflected upon that. So they've opened my eyes up to many specialties and then related it to what they've actually done in a dental lab. And then we have got this bit here. I'm just going to scroll the screen because it's quite a lot. Currently in my gap year, I've taken active steps to arrange hospital placements alongside Specsavers. So then they've talked about, so this is just to reiterate, this is actually the same person that has revised their statement. So from patient queries and pre-test, so they explain their role, and then they've gone on to link the book and then link the community work that they do and link it into some interesting historic oral hygiene habits. And in addition to that, shown some research into how that has actually affected their dental health. In addition to that, they have then gone on to conclude. So the last paragraph is very much a summary of everything and the conclusion, as well as talking about individual personal points, which may be good fundamental building blocks towards a career in dentistry. So then they've talked about their involvement in their school or college and what they've developed in that role or in that time there, as well as any sporting activities that they've done. And then they've also, again, talked about their musical instrument. And then they've summarised with dentistry is a rewarding yet challenging career which requires dedication. However, my experience so far have taught me, have shaped me into a caring, well-rounded, self-motivated individual who's ready to embark on this exciting journey. So it's a very nice conclusion to end with. So as you can see, the difference, although subtle between the two, this one flows very well. There's quite a lot of, if we break each paragraph down, this individual's obviously mentioned points, but they've been very specific in linking them back to how that affects dentistry, whether it be dental decay or communication. And of course, they've obviously looked, they've not only gone to dental practice in labs, but they've read other books and joined societies to broaden their knowledge as well. So that leads us on to the questions. So we're about an hour in now. So if anyone would like to ask any questions, please don't hesitate to mention them in the chat. We've just got some QR codes here just off some of the services that we offer. But we'd like to thank you for joining our webinar today. And if anyone has any questions, we will be running the webinar for another 5 minutes, just to allow anyone to type their questions in, or if you feel comfortable, just to unmute yourself and speak, and we'll be happy to answer your questions. Just on the screen, we've got some of our services which are very popular. So we mentioned our book earlier, that's a QR code to the Amazon website. And of course, I think in the chat, I've mentioned about the personal statement examples, which are freely available on our website. And there's also some more tips and advice there. In addition to that, we've got our personal statement review service, which is where individuals can submit their statement. You get 2 revisions of your statement. They're all reviewed by a dentistry student, and you'll be able to have a detailed breakdown of your personal statement with feedback, as well as dentistry related questions specific to your statement. Once you get your feedback, you can then modify it and resend it back to us, and then we do a final check over it to make sure you're happy with it, and also give you a score as well. So it's a useful tool to aid with getting an extra person's opinion who's been through this process before as well. So in addition to that, we have a free dentistry call service, which is basically where you can speak to a dentistry student. As our team have mentioned, if you have already been, if you're already in this process and you have some questions, then you can sort of book a free call, and we'll be happy to answer any questions that you have. So if there's no further questions, I think someone's put in a question. So the dentistry personal statement is £45 for the review. That includes 2 revisions of your personal statement. It includes 5 dentistry related questions to your personal statement, and it also includes a score. In addition to that, they'll also be reviewed by a dentistry student. In addition to that, you can get 50% off if you are eligible for the bursary. We've got a question here to say that previously an individual has done suturing using real equipment, and they would like to ask whether that can be included in their personal statement to show manual dexterity. And absolutely that can be, because you have done some valid experience where you've obviously been involved with suturing and using the equipment. So that's definitely something that you can include, absolutely. So we've got another question on graduates. So should the majority of your personal statement be centered around the previous degree, especially if it is science related? We always advise that you have a structure to your statement, as we've mentioned. So having a really good structure, which includes your why, the experience that you've had in your previous degree or experience that you've done as an undergraduate, and then obviously your conclusion is key. I think it's important not to consume the majority of your statement with your previous degree unless it's very, very relatable. But our advice is definitely have it read over by friends, colleagues, and if you can, dentistry students or dentists, to see whether it flows well and whether the content that you've written is appropriate. I think that's the key thing. Okay, fantastic, guys. So thank you very much for attending. We will be uploading this onto YouTube for everyone's benefit. If there's no further questions, then I'm going to put this meeting to an end and thank everyone for joining, and of course thank our team for lecturing and providing you with their insight.